Hello, welcome to the AlumierMD online training academy. My name is Victoria. I'm a clinical educator for AlumierMD, and in this video we'll be exploring pre and post peel instructions to help optimize your patient outcomes from your professional treatment series. Without doubt, the consultation is the most important part of your professional treatment. This helps you identify your patient's skin types and concerns and also manage your patient's expectations. It will also help you to consider any adjustments that may need to be made to your professional treatments, or if pre-acclimatization is required. For example, Fitzpatrick 1 through 6 can receive a neutralizing peel as it's a light exfoliation with no pre-treatment required. However, with Fitzpatrick's 5 and 6, acclimatization period and suppression of the melanocyte is necessary to ensure that we avoid post-inflammatory hyperpigmentation in response to a self-neutralizing peel. Your Fitzpatrick 5 and 6 clients should pre-treat the skin with even tone brightening serum and IntelliBright serum, as well as a broad spectrum physical SPF to suppress melanocyte activity, calm the melanocytes, and make sure that there's no pigmentation rebound in response to the trauma created by a chemical peel. Men wishing to have a chemical peel should avoid shaving the day of their treatment. They should save 24 to 48 hours before their chemical peel. They should also avoid shaving 3 to 4 days following their chemical peel, which means that the date of their treatment may want to be considered. It's also important to take into consideration social engagements your clients might have. For example, if a patient is customer facing at work, she may want to experience her peeling or shedding downtime over the weekend. However, if your patient has a wedding or social event to go to on the weekend, she may wish to have her chemical peel performed on a Monday or a Tuesday, so her downtime is at the end of the week and she's recovered fully by the weekend. Your consultation is an excellent opportunity to ensure that your client fully understands the likely and possible outcomes from a chemical peel. It's also important that you manage their expectations, as some clients expect miracles from one chemical peel. Your consultation is the best time to ask your patient how they might be feeling about their professional treatment. There are some lingering and archaic ideas that chemical peels are painful and uncomfortable. This is a really important time to educate your client on what to expect when having a chemical peel. Before starting your professional treatment series, it's imperative that you have a completed, signed and dated patient profile form. This highlights any medical conditions which may mean adjustments to your professional treatment series. It's also important that your client has read, understood and signed and initialed the patient consent form. This highlights things to do before, during and after a chemical peel. We believe in light to medium depth peeling supported by correct adjunctive skincare. So hopefully after your first treatment in a series, your client will take home their specialised treatment serums. This would include vitamin A and specialised acids to enhance the patient outcomes achieved by your professional treatments. When your client is having a chemical peel every 2, 3 or 4 weeks, it's imperative that your client suspends use of those active ingredients 3 to 5 days before their chemical peel, depending on skin type and sensitivity level. A patient with an indication of sensitive skin or rosacea may wish to suspend their use of vitamin A and acids 7 days before their chemical peel. If you wish to accelerate the cellular turnover achieved by a chemical peel, you could ask your client to continue their use of their retinol up to 3 or 2 days before their chemical peel. Once you have completed your chemical peel, it's vital that your client fully understands the post-care instructions. Your client is to maintain their use of the post-procedure kit instead of active skincare 3 to 5 days following their peel. The post-procedure kit contains the Sensicalm cleanser, the recovery balm and the sheer hydration with specialised ingredients to support the skin immediately after a chemical peel. It's imperative that after any chemical peel, your client avoids swimming, heat, including steam rooms and saunas, fake tanning and any other exfoliation or waxing. After a self-neutralizing peel, it's imperative that the patient does not get their skin wet for 8 hours. This could reactivate the salicylic acid, and your client could experience a reaction to the chemical peel even after they've left the clinic. It's imperative you educate your client on the importance of wearing a broad spectrum physical sunscreen every day in between their chemical peels to avoid photosensitivity and suppress pigmentation. No heat in the skin also includes arduous activities that could induce your client to sweat. This includes exercise, standing over hot pans and dishwashers, so no housework that evening. If your client has any concerns following their chemical peel, make sure they feel comfortable to phone the clinic and speak to you directly. Reassure them that they will have a slight action in the skin, but this is not an allergic reaction. We want this erythemic response, we want this redness. This indicates that change is happening and exfoliation is occurring. Thank you very much for listening. If you require any more support or information on this topic, please contact your local business development manager or regional trainer who will be happy to support you further.